Hi, my name is Kimberly Rose, and I'm going to be conducting my assessment on my patient. So as I enter the room, I'm going to introduce myself. Hi, Mr. Rose. I'm Kimberly Rose, and I'm going to be your nurse today. I'm an RN to BSN student. How are you?
Great.
Good. So I'm going to go ahead and wash my hands for good hand hygiene, and then throughout the assessment, I'm going to provide as much privacy as I possibly can. So Mr. Rose, what brings you to the clinic today?
Routine physical.
A routine physical. Okay. So I'm going to be performing a head-to-toe assessment on you, and at first I'm just going to ask you some random questions, okay? Do you have any allergies?
No.
Okay. Can you state your name and date of birth for me?
Brandon Glenn Rose, 7/31/81.
Okay. Are you currently taking any medications?
No.
Okay. Have you had any previous surgeries? Have you been diagnosed with any diseases? Anything like that?
No.
No. Are you having any problems or in pain right now?
No.
No. Okay. So, can you state where you are?
In the hospital.
Okay. Do you know what day it is?
It's April 27th.
Okay. So just by conversing with the patient, he is alert and oriented. As far as like his posture, he's sitting there, his arms are relaxed, he's able to verbalize and answer my questions back. He's making good eye contact, and he appears comfortable during this assessment. So the next thing I'm going to do is just go ahead and observe before I go ahead and start with the head to toe. And the one thing that I do notice is his color is nice and pink. It's evenly throughout his face and his body. And then we're going to go ahead and get started with his head. So what I'm looking at right now, his head is very symmetrical. On his hairline, it is evenly distributed. His hair does, it's kind of coarse and thin. I don't see any abrasions or anything like that on his scalp. I do not see any infections at all, or any type of organisms or anything like that living. One thing that I do notice is that he does have a, looks like a sunspot right below his right eye that I will annotate. I don't see any moles or lesions or any open wounds or anything like that. Going down to his eyes are symmetrical. They are aligned. They're nice and pink. I don't see any redness, no swelling. His sclera is nice and yellow, or nice and white, excuse me. There is no yellowness. The next thing I'm going to do is assess his conjunctiva. So I am going to go ahead and just pull down. And it's nice and pink. There is no redness, no drainage noted in the eyes at all. His eyebrows are even, both bilaterally. There is even hair growth as well. His eyelashes are evenly distributed. Like I said, there's no drainage or anything like that. So the next thing that I am going to do is to get my pen light out, and I'm going to check for his pupillary reaction. So just look straight at me, Mr. Rose. Which both eyes were reactive to the light. The next thing that I'm going to do is have him follow my finger in the 6 different directions. Okay, and then I'm going to attest for accommodation. So I'm going to have you look at this object, and I want you to follow it all the way to your nose, and then I'm going to have you look at the wall behind me, okay? So follow it all the way in, and then look at the wall, okay? So both eyes do have perla, okay? The next thing that I'm going to look at are the ears. They are symmetrical on both sides. They are not low set. I do not notice any lesions or anything like that. There's definitely no piercings, no scars, no discharge or anything like that I can see. And then the next thing that we're going to do, I'm going to assess the patency of his nares. So I'm going to close one of your nares, and I'm just going to have you take a deep breath through your nose, okay? Okay, and then I'm just going to do the opposite. So both nares do appear patent bilaterally. And then the next thing that we're going to do is I'm going to look in his mouth at his oral pharynx, and I'm going to be looking at his tonsils. So go ahead and open wide for me and look up just a little bit so I can see. Open all the way up. So his tonsils to me appear to be +2. And then the next thing that I'm going to be assessing is his gag reflex, which would indicate whether his cranial nerves 9 and 10 are intact. Okay. Sorry. And they are intact. The next thing that I'm going to do is assess his tongue. So go ahead and open your mouth again. And it's nice and symmetrical, nice and pink and moist. He's moving it side to side, so that tells me that his cranial nerve is also intact. Okay. So from here, the next thing that we're going to do is go down into the throat area, and I'm just going to check and make sure the neck, if you can look up for me, is aligned nice. I don't see any masses, no bulges or anything like that. I'm going to check the placement of his trachea, which is nice and midline. Okay. The next thing that I'm going to assess is I'm going to listen in the carotid area for any type of bruit. So I am going to be listening with my stethoscope. And go ahead and just look up just a little bit. And I do not hear any bruits in his carotid arteries. So the next thing that I'm going to do is palpate and just making sure that there are no lymph nodes that happen to be enlarged. And I do not feel any enlarged or swollen lymph nodes at all. Okay. The next thing that we are going to move on to would be the abdominal assessment. So I am going to have the patient go ahead and rotate. And then I am going to lift up his shirt. Okay. So the first thing that I'm going to do again is just inspection, making sure that I don't see any masses, I don't see any striae, no palpitations, no peristalsis noted at all. There's no scars. I do see a birthmark, which is located right here in the right upper quadrant. So after inspection, I'm going to move into auscultation. So I'm going to listen for bowel sounds on all 4 quadrants. And his bowel sounds are normal active at this time in all 4 quadrants. So the next thing that we're going to do is percuss. All right, so I'm going to percuss in all 4 quadrants. Mainly what I heard in all 4 quadrants was a tympanic sound, which just means that the abdomen is filled with air. If there was a dullness sound, then that would mean that there would be a mass of some sort or just over an organ. So the next thing that we're going to do is light palpitation, and I'm going to do this on all 4 quadrants. And then just let me know if you experience any pain or anything like that, okay? Okay. And then from the light palpitation, I'm going to go into deep palpitation. So again, just let me know if there's anything that feels painful or uncomfortable. Okay. And I did not feel any masses or anything like that. So that right there completes the abdominal assessment. So I'm going to have my patient sit back up. One thing that I did not assess is the cranial nerve 7, which I'm going to have him do some random things. So can you squint your eyes as tight as you can? Okay. Can you wrinkle your forehead for me? Okay. Can you puff out your cheeks? Okay. Can you stick out your tongue? Okay. And so that right there tells me that his cranial nerve 7 is intact. So from there, the next thing that we're going to do is move on to the neurological assessment. So the first thing that I'm going to do is actually do the deep tendon reflexes. So I'm going to grab my hammer. And I'm going to start with the arms. Actually, just relax. Move on to this one. Okay. And then I'm going to have you sit all the way back. And one thing I'm going to have you do is actually hold your arms out just like this. So that way your legs are completely relaxed. And then I'm going to check your reflexes. And on the next leg. So all of his reflexes are normal. They're about +2. So they are good to go. The other thing that I am going to do is check his Achilles. So I'm going to have him actually lay back down. And then go ahead and flatten this leg out. And then bring this one out towards me. And then scoot up just a little bit if you can. Okay, and then we're going to do the same thing with this one. Okay. And his Achilles was also +2 and good to go. So the next thing I'm going to have you do is sit back up. And then I am going to measure his strength on his upper body. So I'm going to put my hands on your shoulders and I just want you to push up against my hands. Perfect. And it's nice and strong and it's equal bilaterally. The next thing that I'm going to do is have him squeeze my fingers. Go ahead and squeeze. And his strength is strong and bilaterally as well. The next thing that I'm going to do is have him stand up. And I'm going to have you make sure that we have range of motion. So I'm just going to have you bring your arms up and then back down. Okay. Excuse me. The next thing that we're going to have you do is of your legs. So actually, if you could just lay down for me again. And then I want you to lift one leg up in the air and then back down. Good. And then bend at the knee with that same leg, up and bend, and then back down. And then do it with the other leg, please. And back down. Good job. So range of motion, he has full range of motion. Everything looks perfectly fine there. Do you exercise on a regular basis?
Yes.
Do you consider yourself fit,
For the most part.
very active?
Yes.
Okay. The next thing I'm going to do is have him stand up, and I'm going to perform the Romberg test. And just stand up straight with your arms down, and then I want you to close your eyes. Okay. So his Romberg test is negative. So go ahead and sit back down. Okay. And then the last thing that I'm going to do is inspect his spine and then his gait as well. So go ahead and stand up and turn around for me. And I'm going to lift up your shirt and inspect your back. And then just kind of bend over just a little bit. So his spine seems nice and straight. I don't feel any curvature or anything like that. Go ahead and sit up straight again. Okay. And then step over here towards the end, and I just want you to walk to the other side of the couch and back. Okay. And his gait is equal bilaterally. There's no issues whatsoever with him walking. So just go ahead and have a seat. That concludes our assessment, Mr. Rose. Do you have any questions, concerns, or anything like that for me?
No, ma'am.
Okay. Thank you.